All right, guys, we're going to move on to transport operations. This kind of goes back to that boring but important. It's not super exciting, but some of these you might have some questions on the National Registry about different types of ambulances and stuff like that. So we'll try and get through some of the fluff quickly. So basically, we've needed some sort of ambulance service for the past 100 years, but really we didn't get good at it, I guess, until like relatively recently. 70s, 80s, 90s is when we started doing all this stuff and having increased technology and those things. Ambulances even before then were basically a taxi ride, and there wasn't really a whole medical care being given. So there you go. It wasn't except for in warfare, they had ambulances in war, and that they would do medical care. But like the first ambulance service in New York, they just basically was a taxi service. So um, okay, so this is what they contain: driver's compartment, usually two EMTs with two patients, radios, all that fun stuff. Okay, so I know this sounds weird, but this might be one of the things you see on the test. I don't think it's important, but they do. So type 1, type 2, type 3, okay? So type 1 is like the one you're thinking, you think of an ambulance, type 1. Type 2 is like a van, and then type 3 is like a specialty van. So yeah, here you go, cool. So all right, these are the phases of the call. We'll just burn through these real quick. It's just basically like they're breaking down how 911 works basically. So preparation phase, that's when you are not on the call and you are just preparing everything. And as an EMT, yeah, that's kind of something you'll have to be doing is cleaning out the ambulance, sterilizing it if you need to, packing equipment, all that fun stuff. I will say this, with these ambulances, they can be a little bit different inside. So go through all those drawers and cabinets and all this stuff you can see here in the pictures. Like know that stuff is forwards and backwards, because if you need it, you can't waste time trying to look for it. So these are just some of the things that are going in there. So this won't be on the test or anything, but basically a jump bag. This is like what they normally carry out into people's houses and stuff. This is what they bring for EMTs. Okay, so there goes. Got to have all that safety equipment. There's sticklers on road vests and all that fun. Got to have that. Extrication equipment. Yeah, not necessarily going to be on the test, but this is just some of the things that they're going to have in their own equipment. So 2 EMTs are strongly recommended. I would agree. Okay, so know all that stuff. Okay, dispatch phase. So someone's going to call and they're going to try to get the nature of call, the name, location, all that fun stuff. And then you get dispatched and you drive. So basically, this is the most dangerous phase for EMTs, especially with traffic and weather and things like that. So scene size up, and then you're reporting that back to dispatch just to tell them what do you think's going on. Kind of like that initial scene size up thing where you're doing PSI, scene safe, no C-spine, one patient. All that stuff you basically are going to say over the radio. All right, mass casualty incidents. That's just when you have a bunch of patients. Okay, so basically an ambulance is huge and it can really stop up traffic if you put it in the wrong spot. So you do need to park it obviously somewhere nearby, but try your best to not hinder traffic unless you need to block traffic. And usually law enforcement will talk about that. So usually park 100 feet away, at least initially. Don't park next to the crash scene, on a highway. There's lots of fast cars and all that stuff. So for that, really, you want to park in the safest location. And if you're worried about traffic or something, then call law enforcement and they'll take care of it. So there you go. And like I said, I would go past the accident in the direction of travel, because that way when it's time to leave, you can just go. You don't have to worry about the crash scene. So you always want to park uphill and upwind from any sort of hazardous smoke. If you see smoke at all, who cares? Uphill, upwind, don't mess with it. That's that scene safety thing. So basically, just when you park, make sure it's in a safe location. Okay. Traffic control enforcement if you need to do it. Transfer phase. So this is when you're like you've done your initial treatment and now you're going to start preparing the patient for evac. So you get them loaded up. And interesting thing, I know we all love lights and sirens, and that sounds cool, but actually it doesn't make a difference, it turns out. It saves, I think, on average, depending on location, it might save 3 or 4 minutes. during the entire run call. So, and they're like, okay, so we're doing this very risky thing, you know, speeding around, running red lights and stuff, and we're only going to save about 4 minutes. And so we're actually, some EMS agencies are actually getting away from light sirens all the time. Remember, stable 15 minutes, unstable 5. Okay. Delivery phase, this is when you are reporting, this is when you deliver the patient to the hospital and you're going to give that patient report. If you all remember that from the medical assessment. Okay, so now if you are still in service or not, like if you need to run back to the shed and restock, then that's what you got to do. Post-run phase, this is the boring phase everyone hates, but just because it's lots of paperwork. You got to write all the reports and refuel the vehicle and all that fun. So cleaning versus disinfecting, well, nowadays it's going to be probably a lot of disinfectants in there with COVID. I don't necessarily think there's to be sterilization here, but it's at least sterilized, not high level infection. So, all right. So we're going to change all that stuff out, discard medical waste, wash contaminated things with open water, clean it up. Yep. So they're saying clean the stretcher, germicide, virucide like solution, or you can do 1 out of 100 bleach. But basically, we're just saying just clean it between patients. Okay, and then try and create a schedule that helps things. So defensive driving, all they're saying here is people do die in ambulance accidents. And so the big push here is safety, safety, safety. So driving defensively, not speeding, not do sirens unless you absolutely need to. Sirens just makes everybody amped, everybody. It makes drivers on the road amped, it makes you as a driver, it makes the patient. So really weigh that out if you really need lights and sirens. So there you go. Make sure you're wearing seatbelts and stuff. And because if you're in the back of that patient compartment and you're not strapped in somehow and there's a wreck, you're going to be flying around. So just make sure you use safety seriously. So there you go. It's just, sure, this is just kind of defensive driving, safe driving tips. Okay. Once again, it's just talking about that. The lights and sirens thing, maybe not necessary anymore. So just make sure you're doing safe following distances and all that stuff. Just be safe. Don't speed unless you absolutely need to. Use a spotter when backing up. I've definitely seen that go bad a few times. This is just talking about how to take a turn in a bigger vehicle. Okay, weather conditions, just understand that, yeah, if you have bad weather, your transport time is just going to be that much longer. Okay. If you decide to do lights and sirens, you can probably do a few different things. You can probably, if you need to, safely, you can drive the wrong way on a road or, you know, run a stop sign, something like that. But remember, it doesn't necessarily save a ton of time, and you are risking you and your patient. So be careful when you're doing that stuff if you do it. Okay, so that lights and siren stuff. Okay. Use of escorts, that's really like if you're doing some long, like rural evac or something, you don't know the area at all, but the law enforcement can be escorts. But, you know, here in Boise, we probably won't encounter that much. Okay, so just saying, yep, those are things you have to drive on. Try and minimize distraction when you're driving around because distracted driving does kill people. So fatigue, this is a struggle for EMS because, you know, we're doing 24-hour shifts and maybe the shift is 12 calls or something and you just don't get a time to sleep. So you have to monitor your own fatigue so you're not putting anyone at risk. Okay, this is just air medical operations, so fixed wing and rotary wing. They have basically, you can be an EMT on ground, like life flight ground support, and usually the medics in the helicopters are going to be critical care paramedics, flight nurses, those things. So basically, if the transport by ground is too long or there's crazy traffic or something like that, you may do a medevac. Or some sort of time-dependent injury like a stroke, heart attack, those kind of things. Okay, and usually dispatcher, and you'll call that up and be like, hey, I think we need this, and then they work it on their end. You don't call the helicopter. If you need to make a landing zone, it's between 60 and 100. I would just say 100 by 100. Just keep that, you're supposed to park 100 feet away, and the landing zone needs to be 100 by 100. Just remember that. Okay. Yep. And then this last little bit is going to be just about helicopter safety, keeping on safe distance, stay away from the tail rotor. You always want to approach it either from the front or the side. But the thing is, they'll tell you, the crew chief or whoever it is in the ambulance, or they'll direct you. So if especially if you're unsure about the correct way to approach the ambulance or anything like that, just wait. And they might even shut down. And then if it's a super non-emergent thing, they might actually spin down the helicopter, turn it off, and then you can work, stabilize the patient, and evac. So just, yeah, remember these guidelines. Okay. Night landings, just, yeah, don't shine flashlights at pilot. It's a good idea. On even ground, remember it's a hill. You have less area on the uphill side, so approach from the downhill side. Okay. If there's some sort of hazmat thing, you need to let them know. Most helicopters are limited by about 10,000 feet, and honestly, you don't really want to fly that high. Now, on a plane you can, but in a helicopter, you're flying at 10,000 feet. You start to do some pretty weird things with like oxygenation and stuff like that, right? And think about an ET tube bulb, right? If it goes up, that might alter the pressure inside the ET tube. If the guy has a tension pneumothorax and there's air in his chest, well, that's actually going to get worse if you go up to 10,000 feet. So just be careful with that because they're not pressurized. And they are super, super expensive. And a plane even more so. But once again, if it's plane versus helicopter or whatever, that's going to be a dispatch thing. So there you go. Hopefully, Carol Baskin can set us free.